Hello everyone, I hope you're all well. Today I'd like to alert you to how governments are subverting the advice of scientists. The world's captains of industry and government leaders have aligned to prematurely roll back on lockdowns. The scientific community, however, believes it is too early to do so. This will endanger human lives, hundreds of thousands may be killed, and economies will suffer even more. You're watching Age of Pandemic, and this is episode 6. As we speak, much of the world's population is under some form of lockdown measures. Many places around the world are either already out of lockdown or in various stages of reopening. Now, a visitor from the future might think that this lifting of lockdown is happening against a backdrop of some dramatic improvements, some breakthroughs in medicine. They may think that maybe some vaccine has been developed and by some miracle it is already under use. Maybe some affordable line of treatment has suddenly been invented and is being shared between governments at lightning speed. Maybe there are fewer deaths. But there is evidence that the sting of the coronavirus is getting deadlier by the day. Our leaders are clearly failing to read the enormity of the problem that has hit. But look at the pomposity. Let's ignore the scientists. Do our leaders think that by pretending that a problem doesn't exist, by pretending that COVID-19 is just another natural calamity, the daily death toll of a few thousand will be normalized by mankind?
Most businesses nationwide are now permitted to open as long as they can follow social distancing rules. Italians who rushed out to get their first professional haircuts and manicures or sip a store-bought coffee were greeted by a new normal of plexiglass and face masks.
The fountain of this imperialism of foolishness is the Honorable President of the United States of America.
The data suggests that nationwide we have passed the peak on new cases. Hopefully that will continue and we will continue to make great progress. These encouraging developments have put us in a very strong position to finalize guidelines for states on reopening the country, which we'll be announcing. We're going to be talking about that tomorrow. We're going to be announcing guidelines, and we'll be talking about various states, and it's very exciting.
It is the most followed nation in the world, and every action taken at the highest level there serves as a paradigm for most countries. Yet, in the United States of America, the nation that other nations look up to as a model, all 50 states have at least partially reopened. After 96,000 Americans have died. Using skewed economic logic, combined with academic gymnastics with curves and graphs, the establishment is trying to assure us, the frightened masses, that we need not cower at home under lockdown, but that we should go out and treat the pandemic as if it were just another episode of bad weather.
Let's not try and do a post-mortem of history, but instead look forwards here. Definitely, let's be honest, Nidhi, India's greatest success has always been in our community engagement, in bottom-up grassroots approaches. We've conquered many things in the past.
Now, the World Health Organization has advised that lockdowns should be lifted in a slow and steady manner. We have been cautioned that lifting restrictions too soon would lead to a deadly resurgence.
I know that some countries are already planning the transition out of stay-at-home restrictions. WHO wants to see restrictions lifted as much as anyone. At the same time, lifting restrictions too quickly could lead to a deadly resurgence.
The World Health Organization has advised several public health and social measures like movement restrictions and closure of business, or in other words, lockdown. Guidances are issued from time to time on how to loosen these measures. There are various criteria for relaxing restrictions. One of them is based on epidemiology, that is, an indication that the disease is controlled. This is determined by a continued decline in the number of confirmed cases over a 3-week period. Another parameter is the capacity of the health system, that is, hospitals can manage COVID-19 patients as well as other patients and can cope with at least 20% increase in the COVID-19 caseload. But the opposite is happening. As I was finalizing the script for this episode, there were reports of the biggest spike of COVID-19 cases in 24 hours in some countries, including those that are in the process of lifting lockdowns. Moreover, healthcare systems around the world are overwhelmed. Doctors and staff are overworked. Warnings of a healthcare collapse are being reported. So, lifting lockdowns now flies in the face of the WHO guidances. We are being told that the downside of saving tens of millions of lives is unemployment for tens of millions of those who have not been affected. But they don't tell you that had there not been lockdowns, those tens of millions whose jobs are sought to be saved would have probably also perished. In Germany, where factories recently reopened, at least 68 of 1,800 employees were infected at an Amazon distribution center. 300 workers were infected at a meat processing farm. So, the political elite is working at the behest of big businesses to reopen economies, while more and more people are catching and dying from the coronavirus. Yes, it is undeniable that the lockdown response to the COVID-19 invasion has devastated the world economy. But there is emerging research that economic activity is reduced in the absence of such public health interventions like lockdowns. This working paper by economists at the Federal Reserve and Massachusetts Institute of Technology relies on data collected on the 1918 flu pandemic in America and suggests that lockdowns may actually help economies bounce back faster. We are being told that there will be a vaccine in the market very soon and everything will be alright within a year. And so, the argument goes, there is no point destroying the economy just for a few thousand lives.
But are we being sold a lie? After all, COVID-19 is the 7th coronavirus to strike mankind, and we've never found a vaccine for any of them.
We are very confident that we're going to have a vaccine at the end of the year.
Don't get me wrong, I am not downgrading the scientists around the world who are working tirelessly in finding a vaccine against this virus. But vaccines take decades to develop. That is because it takes a long time to collect, collate and analyze information on the virus. So how can we trust the corporates who are issuing rosy press releases saying that they can bring out a vaccine by 2021?
The only way to keep it at bay, if you have a very good vaccine that makes antibodies that's going to neutralize the virus and clear it, that's wonderful. But for 20 years, many companies, many researchers have promised us a virus for SARS version 1. And we are in 2020 and this vaccine doesn't exist.
Since April, hardly a day has passed since good news has flashed in some corner of the internet or the other. But on the other hand, we have scientists offering sobering thoughts. In fact, Chris Whitty, the British government's chief medical officer, has stated quite unequivocally that chances of a vaccine being on the market in the next calendar year are incredibly small. Even if the much-hyped Oxford University vaccine is developed by next year, it would be saner to continue with the existing restrictions. Instead of lifting our morale, the media is publicizing the hit to the global economy caused by COVID-19.
As a third of the world practices some form of a lockdown to slow down the spread of COVID-19. And all of this is having an impact on our global economy. Industries like airlines, import-export companies, tourism, retailers, events, restaurants, and many other non-essential services have been hit, some harder than others. The United Nations says we may see a $2 trillion shortfall in our global income and a $220 billion hit to developing countries, excluding China.
220 billion is not that much. Actually, far more is spent on guns, combat planes, aircraft carrier ships, moving soldiers around the world.
Global military spending is on the rise. That means more and better equipped soldiers on land, more warships at sea, and more high-tech fighter jets in the skies. In 2018, worldwide military spending hit $1.8 trillion.
Big business, governments and the media are pushing for an end to the lockdown so that things can go back to normal. I want to tell you that we should not rush back to normal. The society emerging from COVID-19 will be pulled back by existing problems that will have intensified because of the pandemic. In the previous episodes, I had touched on the effect of the pandemic on the psychosocial world of the 21st century. Please watch them if you haven't had the chance. I don't focus on how industries and airlines are reeling under the impact of the pandemic. I talk about the ways in which the human mind has been reshaped by COVID-19. Like the coming depression, which, unless budgeted for, may lead to a whole generation being rendered unproductive by manic depression and unprecedented rates of suicide. Or how women, particularly millennial women, can expect to face greater discrimination at the workplace as corporates are forced to cut back on employing women or deny them hard-won benefits and the like. What we need is a new normal. What that is has to be determined by us. Thank you for watching. I'll see you next week. Stay safe.